during these times. Dr. David Black is the founder and CEO of Cortico, serving hundreds of public safety agencies nationally. He's a board member of the National Sheriff's Association Psychological Services Group, serves as the chair of technology and social media, and is an advisory board member for the National Police Foundation's Center for Mass Violence Response Studies, serves on the IACP Police Psychological Services Ethics Committee, serves on the National Fraternal Order of Police Officer Wellness Committee, serves on the California Police Chiefs Association Human Behind the Badge Committee, and is an officer wellness subject matter expert for the California Commission on Post. He's been serving law enforcement since 2002. I do have a disclaimer. The materials provided in this webinar are for general information and educational purposes only. The materials are not intended to be and should not be considered legal advice or opinion. Please seek legal counsel before acting on the topics discussed. The materials are not intended to be and should not be considered a substitute for clinical diagnosis or professional medical advice or opinion. Please consult with your physician, therapist, or other qualified healthcare provider before acting on the topics discussed. And with that, I'm going to set David as our spotlight video and take it away, David.
Carol, thank you so much for that intro, and thanks to CPOA for hosting this. Are you able to enable share screen on my side?
I believe I can. Give me a moment here.
And thanks so much to everyone who's taken the time to be on here today and anyone who watches this. We appreciate you very, very much. I think I speak on behalf of all of California and all the communities and everyone out there that just deeply, deeply appreciates the work you do every day, but now more than ever, the sacrifices and the service that you're providing in our communities. So we thank you very, very much for that. And what we want to do today is provide you with as much information as we can, as quickly as possible. So this is going to be relatively short pace, fast pace, and we're going to be covering a lot of material here. We also want this to be interactive. So, and I apologize for the disclaimer. But let me start off with a question to everybody. How many people, and using the response icons that you have there on the screen, click yes if you perceive that people in general are facing a very high degree of stress and uncertainty at this time. So yes, if that's something that you perceive. Yep, and we've got yeses going up. So this is more a test of the system. I'm imagining everyone would respond yes to this. Everyone's under a high degree of stress and uncertainty at this time. So certainly some people are. So, and then the issue is, yep. And so the issue is law enforcement are serving on the front lines of this stress and uncertainty. And we all understand that. And law enforcement are not immune from this stress and uncertainty. And in fact, because they're serving on the front lines, they're having to deal with this on two levels, of course. You're having to deal with this on your personal level and your family level, but then you're having to deal with this in your job every single day. So we're going to cover a lot of information here again, and feel free to chime in at any point with questions or comments. So the first key in any sort of high stress crisis situation is be informed. Be aware of what the enemy is. What are we up against? And so there's QR codes here on these slides, so you'll be able to see as we go through this. And you can scan these with your phone, and then we also have a document we'll be sending out that has this information as well. So you can scan this, and it'll take you straight to the Centers for Disease Control and Prevention, what law enforcement personnel need to know about coronavirus, COVID-19. And so you can pull that up. You should be reviewing this, stay informed. It's got a lot of good information for law enforcement. There's a lot of other resources out there. There's a ton of resources out there. It's important to restrict information to high quality sources. So CDC has its own up-to-date page on specifically what law enforcement personnel need to know about during COVID-19. Another great resource is Lexapool. Which has stepped up, and they're providing free training to both law enforcement individuals as well as law enforcement agencies. So you can get free COVID-19 policies, courses, and training tools at the Lexapool website. So I encourage you to take a look at that. Also, and this was an article from the medical journal Lancet that was just recently published on February 26th. talks about the psychological impact of quarantine, talks about how to reduce it as well. But I think some of the best key takeaways from this are to understand that quarantine is very, very stressful for people. This is something that's been studied worldwide in past outbreaks. And people in quarantine tend to experience fears, frustration, boredom. They deal with inadequate supplies, and that's certainly the case now where people are going to stores and there's been a run on certain goods, and there's lots of confusion, anger. And the longer quarantine goes on, the more these symptoms tend to persist, and people develop effects that include post-traumatic stress-like symptoms. So this is important to be aware of in terms of your own lives, but also when you think about you're going into these homes, if you get called out to domestic violence situations, people are under a lot of stress right now, and this isn't going to go away fast. It's not going to be the case that we flip the switch once the shelter-in-place order is lifted. At that point, we're going to have high rates of unemployment. We're going to have high rates of alcohol, substance abuse, and high rates of stress. Past pandemics have shown us that people tend to go in kind of a push-away mode because they get used to being alone. They kind of socially distance, and so it can take time to get back. So I think it's important as law enforcement, be prepared for that scenario when people come out of the shelter in place. This is an article, and you can scan this and go straight to it, that Crawford Coates, who gave the last leads Zoom webinar for CPOA, just recently wrote. Great article. He interviewed me for it. So you can go here, and this gives you a quick overview. So if you have to get off the call early today, you can take a look at this and get a good overview of some of the tips and topics we'll be talking about today. Talking about some core tools, and the overarching principle you want to keep in mind here for resilience is focus on what you can control, let go of everything else. When you look at people who do very well under high stress situations and people who just perform well overall, they tend to spend a lot of time thinking about what's within my circle of influence, what can I control, and they focus all of their mental time and they focus all of their efforts and energy on that space so they can make a positive difference. And then there's this large amount of stuff that you care about, but it's outside of your sphere of control. And to the best of your ability, you want to let all that stuff that's outside of your control go. Because it doesn't do any good. It doesn't do any good to focus on things that are completely out of your control that you can't influence at all. And we only have so many hours, so many minutes in a day. It's really important to invest those in what you can actually do. So of course, one thing you can control is protective measures and staying up to date on CDC recommendations, good sources like National Police Forum, for example, and discarding poor sources of news, but getting in there and doing what you can. Now, one thing that recently came out is there was a survey of national mayors. More than 90% said that they didn't have adequate protective gear for their first responders. So you're probably in a situation where you don't have access to adequate protective gear. That's the sort of thing that might be outside of your control, so you want to focus on what you can control and take those steps. The other thing that's really important, and if you think of resiliency and resilience as a pyramid, the absolute capstone of that is strong sense of mission and purpose. If you think about, for example, John McCain, prisoner of war, tortured daily for years, solitary confinement for years. If he hadn't had a strong sense of mission, a righteous sense of purpose backing him up, he would have broken very quickly. What sustains people through the worst in life and the most difficult, stressful circumstances is having a strong, righteous sense of mission and purpose that you deeply believe in. If you have that in place, you can endure things that absolutely no one else can. So that's very important for the mental outlook, focusing on what you can control, maintaining strong sense of mission and purpose. One wonderful thing about law enforcement is, unlike so many other careers, is it has baked into it an extremely strong sense of mission and purpose. The thin blue line, right? There to serve and protect the community, there to serve and protect those who can't protect themselves. It's an incredibly strong mission. It's the most important purpose that you could devote yourself to in your life that I know of in your work. And so that's something very, very strong to carry with you. The thing that's happening now is there's a massive series of changes going on in how that mission is carried out in response to the pandemic. And it's important not to let those operational tactical changes that are really, almost all of them are probably going to be temporary in nature, not let those undercut the larger mission and purpose that drives you and keeps you going. A very important physiological tool, tactical tool, is combat breathing, also known as box breathing. So this is something that's important to be aware of. The reason why combat breathing is used by Navy SEALs and elite athletes and SWAT team members and other first responders is because it's a hack for your physiological response to stress. And what you do is think of a box shape, and what you do is you exhale all the air out of your lungs, you inhale for 4 seconds, you hold it for 4 seconds, you exhale for 4 seconds, and then you pause for 4 seconds. And then you just repeat that. Like any other tactical exercise, you want to practice this again and again and again, and then put it into practice once it's very, very easy for you and very familiar for you. Some people prefer to switch it up a bit. For example, and you'll learn this over time with your own physiology as you practice combat breathing, aka box breathing. Some people like to inhale for 4, hold for 4, exhale for 6, and pause for 2, for example. So figure out what works for you through your practice, and then learn that and stick to it. And you can use that anytime. It's what it is it's a hack to allow you to reduce the physiological stress response. So this can be if you're out on patrol and you come into a high stress situation. It can be if you're at home and there starts to be tension with your family, or you get into an argument. What it does is it allows you to reverse that stress response that's triggered in the brain through the limbic system. So the other thing is we keep using the phrase social distancing. And social distancing is something we can't do. As people, we need our relationships. We need our family. We need our friends the same way we need food and sleep and water. So social distancing isn't necessarily the right term. It's physical distancing. And that's the term we really should be using. What you want to do is you want to physically distance, because that's what protects you from the virus. And you want to remain socially close to people. So through all the different ways that you can do that, with your family, with your friends. One thing we find is that texting isn't so good. Texting is a way to quickly check in, and if you want to do that without creating a big need for someone to respond. But particularly people who are alone right now, they really need that phone call. They need FaceTime, video chat. So keep that in mind. That sort of connection is very important. The shelter in place is affecting everyone very, very differently. Right? So how about this? Click yes if you live alone at home. So one thing to think about is, think of 3 categories here. You've got people who live home alone, and imagine how the shelter in place is affecting them. And then you've got people who are in high conflict families, and think about how the shelter in place is affecting them. And then you've got people who are in low conflict families, right? Where things are good, a little bit of time off, more time in the house together. It's these other 2 categories that we got to be more concerned about. But the important thing here, and what you can control, is maintain relationships, stay in touch with the people that you care about, be there to support each other during this time. Another thing, under stress, people have a tendency to revert to negative patterns of behavior. Patterns of behavior that are not proactive, that are not things that represent your values or where you want to go with your life, your goals. Instead, they're reactive responses to stress. So examples include drinking too much alcohol. Examples include eating junk food. Examples include staying up late on the phone, obsessively checking social media or the news, and then not getting enough sleep. And what it is your body's generating cortisol, your body's generating a physiological stress response, and as a default, you go to these behaviors that increase serotonin and have a positive reinforcement structure. But then the thing is those cycle downward. And for example, one thing we see in response to quarantines, people start abusing alcohol more. They start abusing drugs more because they're looking for a way to feel good. And then that cycles in and on itself because it's done in response to stress. And so the natural tendency is over time, it happens more and more and more. So instead, what we want to do is engage in what we call proactive control. Under high levels of stress, where routines have been disrupted, where everything is different, and of course that's the case here, you can't go to church anymore, right? You can't go to the gym anymore. You have to be extremely cautious and limited about even going to the grocery store anymore. So what that does is it disrupts all the normal routines. Meals get disrupted, exercise routines get disrupted, time with family and friends gets disrupted, sleep, etc. It's all thrown in a mix. And so it's almost like you have to come back in and purposefully impose that architecture back onto your life the way it is now. And what you have to do is you have to step back and you think, what do I value? What's important to me? What are my goals? What do I stand for? For example, you stand for safety, security, serving community, taking care of family, taking care of self, etc. Well, how do I proactively create a structure in this new world we're in right now so that those things are being represented? So that's the point there, as opposed to just default slipping into negative behavioral patterns. Here's a resource you can use right away. Dr. Rochelle Zemlock. She's a clinical psychologist, good friend of mine. We just appointed her to our advisory board at Cortico. She's a wonderful psychologist specializing in working with first responders. She's married to a firefighter. She grew up in a police family. She has siblings who are police. And so she's designed this free family mental health 7-video course supporting first responder family mental wellness during the coronavirus pandemic. So you can scan that QR code. It'll take you right there. We'll also give you the hyperlink on the sheet that we send out for that. So I hope people find that very useful. Dr. Zemlock is a real expert on first responder wellness, particularly with regard to families and children. And then Audible really stepped up. This is a nice resource if your kids are stuck at home and you're looking for what else to do with them. Audible has made children's books free for as long as schools are closed. So you can scan this and you can have free audiobooks that you can play for your kids at home and help keep them entertained. And there's a lot of other good resources out there. If you go to the Cortico blog, it's just cortico.com/blog. There's a lot of other resources on there. And we just posted an article by Dr. Kimberly Miller, who's also on our advisory board. And it lists a bunch of different virtual field trips that you can use for your kids, Monterey Bay Aquarium and others that are available right now for free. So IACP, in terms of taking care of yourself and being proactive and making sure that your good, healthy routines stay in place. By the way, if you've been thinking about making a change, say you've been thinking about, I'd like to eat more healthy, this is a great time to do it. The routines are all shaken up right now. Everything's different. So with everything being destabilized, you have an opportunity to restructure in a new way. So healthy eating, IACP has some information on that on their website. This scan will take you right there. Also, of course, sleep. Sleep is really important. I know we all get that in general, but it's absolutely vital to your survival. As you start to pull back on your sleep at all, and of course this naturally happens in the course of working in law enforcement for a wide range of reasons, your health suffers, your immune response drops. You become less physically well, you age more rapidly, and you're not as alert or as responsive to problem solving. So this is really important to take charge of your sleep. Recognize it's an important issue right now. It's been disrupted. It's obviously been disrupted, and so all the more reason why you have to focus on. So some really good tools to keep in mind. One problem with sleep right now is that we're in a temperature upsurge, of course, this time of year. And that disrupts sleep. You want to keep your room cold, around 65 to 68 degrees. So you might want to invest and turn on the AC a little more right now, or leave it open earlier in the day so it cools it off, because otherwise it will be more difficult to sleep just due to the temperature. Also, if you don't have blackout curtains and if you're trying to sleep during the day, strongly recommend you get a sleep mask. Strongly recommend that. They're about $10 on Amazon. And the thing is melatonin production, absolutely key to sleep. It's done by the pineal gland in the brain, and it's triggered by there being absolute blackout and retina input. So sleep mask achieves that and will help you get better, deeper, longer lasting, more rejuvenative sleep. California Police Chiefs Association, winter 2019 issue focused on officer wellness. So if you have time to read, if you want to be thinking about other things departments are doing for officer wellness, scan this. This will take you straight to the digital version. Your chief probably has a physical version in the department. You may have seen that. So it's just packed full of good articles on officer wellness, just to give you some other tools to work with. If you have a peer support team, this is a really good time for the peer support team to be checking in and saying, how are we handling COVID-19? What are our policies? What are our procedures? How are we handling things different now so that we can maintain physical distance, but still strong social connection to our department? And if you don't have a peer support team, that can be one of the few good things that come out of something like this. Is it can kind of snap people to go, hey, we need to have something in place the next time something goes down. We weren't prepared the way we could have been here. So you might want to think about putting a peer support team together if you don't already have one. So this, if you scan this, this will take you to a Q&A that I did with Lexapool on building peer support teams. And we cover a lot of different key topics about how to build and maintain strong peer support teams. If you're familiar with the Panola Police Department and Chief Neil Gang, he put together the Asher model, which is a 7-point approach to officer wellness, which is taken off nationwide, very, very popular. So if you scan this code, this will take you to an article he wrote about this. One of the best things we can do in response to crisis events, we got to get through it, right? But then you think about what could we do on the other end of this? What's our operational debrief at the end of this, and how could we build something in the future? So even though you're not maybe in the space now to be thinking about what exactly would we build, right? The time and energy is being tapped just for the current situation, but starting to plant the seeds in the back of the mind. What's our plan going forward so that we're in better shape in the future? This is a great program to take a look at. Copline is a great resource. Copline's 24/7 free, confidential line you can talk to and speak with a retired officer who's been vetted and trained in peer support. So Copline, and you can scan that, go to their website, very good resource. National Suicide Prevention Lifeline, we're definitely going to see in the general population elevated risk of suicide just in response to all the stress right now. So you got to be aware of National Suicide Prevention Lifeline, again, 24/7 free. It's a network of suicide prevention centers throughout the United States. And so you can call that number anytime to get suicide prevention support. And then I'll just mention, if you do have any time to do some reading, and if you've read any of these books, great. If you haven't, they're wonderful resources. So the first one's a classic, Dr. Gil Martin, Emotional Survival for Law Enforcement. He covers so much great stuff in here. He talks about the cynicism that builds in law enforcement, how to deal with that. He covers that topic better than anyone else. He talks about hypervigilance, biological roller coaster. How many people are familiar with Dr. Gil Martin's book or have had the chance to see him speak? He's an absolutely fantastic speaker. Another one, Crawford Coates, Mindful Responder. This is a great book, and he covers mindfulness and meditation for first responders, specifically written for first responders. If you haven't started any sort of mindfulness meditation practice, if you think it sounds not interesting to you at all, but you want to take a little risk and give a look, Crawford's a great writer. He's done a really nice job with this book. And there's a reason why you'll find police all over the place these days that absolutely swear by mindfulness and meditation. It's a very, very effective tool when it works the right way for someone in reducing stress and maximizing mental focus. Dr. Stephanie Kahn, she's a psychologist up in Portland, Oregon. She and I serve on the FOP Wellness Board together. She's a former cop and a former dispatcher turned psychologist. And she's written this very good book. And if you scan this code, you can get chapter 1 of the book for free. Take a look at that. And this is my friend Brian Casey, who is a cop at St. Paul PD in Minnesota. And I call him the philosopher cop. He thinks very, very deeply about things, and he's put a lot of work and effort into building a strong peer support and EAP program within his agency, and he's written this book, which I recommend. So know this, we support you. 100% behind you. Anything we can do to help you, that's what we're here for. We'll take any questions you might have. We're working with CPOA to put together a free wellness app. So that, keep an eye out for that, and you can find updates on that at cpoa.org and cortico.com. So thanks everyone very much for your time today. And we've got some time if there are any questions or thoughts you'd like to share.
Yes, just unmute yourself and go ahead and ask a question.
Dr. Black, how are you? This is John Carley. Can you hear me?
Yes.
Absolutely, Chief. Can hear you. How are you doing?
I'm doing well. Thank you for this presentation. This is something that I'm looking forward to being able to share with all of our staff. I'd also like to be able to send that out to first responders' families, as sometimes, as you know, information doesn't always travel home as well as we would like it. Can you give your perspective on knowing that there's a lot of leaders within our profession that are making these decisions on policy, the challenges that we're going to face in the days ahead, because it truly is about taking care of our first responders and the stress of what this means. And I'll just use an example, this notion of masks. Police officers and first responders consider themselves superheroes. I don't need to be protected, and yet this is that invisible challenge. But I'm facing officers that are struggling because they're feeling the pressure at home, because the fear that whatever that they're doing each and every day, they're carrying at home, and how to work with their loved ones and trying to communicate this.
Yeah, absolutely. As far as any policy changes, my advice is always put the officer first. Officers out there on the front line, they're dealing with this all firsthand. If every policy puts the officer first, puts their safety first, then that's a good policy change. So I'm a big advocate of wearing the masks. I know there's been some early discussion of the mask is more about protecting others than protecting yourself. Personally, I think the research on that is really limited, and it's not enough to put people's safety at jeopardy. So I think the right kind of mask, cloth mask with right density, I don't logically see how that wouldn't protect someone. And, the thing about it is a lot of us have extremely strong immune systems, and we never get sick. And you know what? It doesn't matter right now. It absolutely doesn't matter because the thinking, and again, this is another thing we need more research on, is that there are certain factors we all know about that determine whether or not you're going to be one of the 3% or so who die in response to this. And whether or not you're part of the 25% who's entirely asymptomatic. And the thinking is that, yes, age is a factor. Gender is a big factor. Men are much more at risk, it turns out, from the early research I've seen. Underlying health conditions put you at risk. But the other thing is there's thinking that there's at least one genetic factor. So you have zero control over that. It's just a genetic factor, and that's going to help determine, if you're a healthy person in your 30s, whether you go asymptomatic or whether you wind up being on a ventilator, it's probably due to some sort of underlying genetic variation. So better to be safe. Easy to put on a mask, take care of yourself, take care of your families, and that's not something you're going to regret doing later on. So we had one question come in. Is there a way to have this entire presentation in some format we can send to our employees and their families? I believe, Carol, this will be available as a URL on YouTube.
Yes, as soon as this presentation is over, we're going to upload it to YouTube, and so it'll be available within about an hour.
Very good. Any other questions at all? Happy to take any questions you might have. Well, thanks everyone so much. If you have any other questions, don't hesitate to reach out. The reason we do this is because we have such tremendous respect and honor and appreciation for what you do. The people out there on the front lines are the people that make the real difference in this world, and just tremendously respect you and your service and the sacrifices you're making every day. So we support you 100%, and thank you very much for your time today and for all you do.
Yeah, thank you, Dr. Black. And just as a reminder to everybody, our next call is on Thursday, and it's enforcing state orders and civil liability issues. We'll have a great conversation going on with Jim Touchstone, who's our CPOA's legal counsel, as well as Lieutenant Jeff Snell with Union City Police Department. So please join us there. And again, Dr. Black, thank you so much.
Absolutely. Thanks so much, Carol, and thanks to CPOA.